administration's focus for a long time has been improving quality of life and increasing affordability for Nashville residents, and today we're going to talk about several ways we're doing just that. A year ago, right here, Nashville took a big step forward in our work to protect the lives of mothers and their infants by launching a countywide expansion of our Nashville Strong Babies program. We want all moms and babies to have the support they need to be healthy from pregnancy through the baby's first birthday. Sadly, more Tennessee women die while pregnant or within 1 year of childbirth than any other state in the nation, and 76% of pregnancy-related deaths as recently as 2022 were preventable. Significant disparities in maternal mortality also persist. Statewide, Black women experience pregnancy-related deaths at nearly twice the rate of white women and at almost 3 times the rate of Hispanic women. Addressing these disparities is critical, and in Nashville, our Strong Babies program is doing just that. Every mom and baby deserve the very best care, so Nashville Strong Babies is open to all Davidson County residents from pregnancy through the first 18 months of childhood. We're focused on an affordability agenda, which is why it's great that the program is totally free for all participants. Nashville Strong Babies is a program where our providers meet with each mom and develop a comprehensive program designed specifically for their personal needs. And the program is creating a scenario where healthy moms, strong babies together produce big results. More Nashville children are celebrating their first birthday, and since the inception of the program, every participating mother has survived. This is a big deal. One of our participating moms is Bailey Laird, who is here with us today. Bailey is a mom of 3, and her last 2 babies have been Nashville Strong Babies. Not only did the program support her with her deliveries, it also supported her dreams. Well-being is more than physical health, and Bailey personifies this. She has said that the support she received from her care manager during the birth of her 3rd baby, Aya, helped encourage her to go back to school to become a dental hygienist. So that's a healthy mom, a healthy baby, and a career path for a strong future for the whole family. Nashville Strong Babies has supported more than 2,000 families over the program's 6 years of operation. 516 of those families were served in the last year, and it could help even more if more Nashvillians just knew about it. And that's why I've appreciated how much attention we've been able to get for the program over the past year. And at the heart of our success and the years that this program was in a pilot period is a very special person, and I would like to invite Deanna Allen Robb to the podium to share with you a few thoughts about the program. Deanna, if you'll come on up.
Good morning.
Morning.
Okay, yeah, make sure we're talking to folks. I want to say thank you again to Mayor O'Connell, the Metro Council, particularly the Women's Caucus Chair, Councilwoman Stiles, and Budget and Finance Committee Chair, Councilwoman Porterfield, for showing up for Nashville families with additional funding for Nashville Strong Babies in this year's budget. The additional funding allows us to expand services to even more families at such a critical time. I extend my gratitude to the Board of Health, our Dr. Melva Black, Director of Health, Dr. Areola, and the executive leadership team for their continued support at the Health Department. Strong Babies team, our Program Manager, Angela Williams, our Doula Services Manager, Dawn Smith, our Nurse Manager, Angela Bofa, and especially the managers, Latanya Inslee, Crystal Witt, Zuri Jones, Donna Jean-Jumeau, and Nikki Truelove, for providing excellent care and support to Nashville families. As has been stated, since we stood here this time last year and announced the expansion of countywide services, this amazing team has supported an additional 516 participants with 0 maternal deaths, 0 infant deaths, and health outcomes that outpace the general population. I also want to say a special thanks to Ms. Candace Jones, the Vice President of Community Impact, for creating the partnership with the American Heart Association that allowed us to provide blood pressure cuffs and monitoring to families with high risk for premature birth. These opportunity around blood pressure monitoring has helped us threatening hypertensive events. And a year later, we're pleased to see TennCare now offering blood pressure cuffs and monitoring as a covered benefit. We've also seen a record increase in the number of Metro employees enrolling in Nashville Strong Babies when they decide to start or expand their families, and it has been our most humble privilege to support our colleagues in their pregnancy and parenting journey. Thank you for trusting us. Nashville Strong Babies supports families, reduces costs, and saves lives. And yet, I would be remiss if I did not acknowledge the reality that Nashville Strong Babies is still largely dependent on the $145 million federal Healthy Start appropriation, and that questions still linger about the reliability of federal funding moving forward. However, we remain steadfast in our commitment to serving Nashville families with the highest quality of services and ensuring all moms, babies, and families thrive. You can learn more about our services, including our upcoming enrollment fairs for expectant families, on our website at nashvillestrongbabies.gov. And with that, thank you.
Well, thank you, Deanna, and thank you again to our Metro Public Health Department for enabling this program to start several years ago, for hosting us today. Dr. Ayla, to you and your board, your leadership team, staff. Would everyone involved in Nashville Strong Babies just raise their hand here today so we can acknowledge you? Yeah, thank you. Well, I'm looking forward to seeing this countywide program continue and celebrating again next year. But with federal funding at risk, this is why it was so important for us to be able to bolster Nashville Strong Babies in our local operating budget that took effect on July 1st. So again, I want to extend my thanks to Metro Council Budget and Finance Chair Porterfield and Vice Chair Quante Toombs for further strengthening our investment. In this budget, we focused our investments in quality schools, reliable services, and safety for all Nashvillians. Nashville Strong Babies is a service making a difference for our families. In that same spirit of supporting Nashvillians' well-being and quality of life, we're trying to tackle food deserts. This week, we released a request for information, fresh foods to neighborhoods that currently classified as food deserts, communities where healthy grocery options are scarce or difficult to reach. It's a systemic issue that needs a broad, community-focused, coordinated response, and we are making inroads. Some key departments and partners are doing some work right now, but we know we can do even more. This week, we celebrated the activation of the plaza in between the Elizabeth Duff Transit Center at WeGo Central and Municipal Auditorium. The Nashville Farmers Market and WeGo are partnering to provide a public market where everyone can shop for fresh food and goods in a convenient location. And as we increase ridership in the WeGo system, even more Nashvillians will have a chance to benefit from that type of event. Just this week, WeGo launched improvements to 6 routes and added weekend service for access on demand, our paratransit service for disabled riders, as well as 2 new WeGo link zones, which allow for ride-sharing access for last mile and access to our transit system. And that is specifically everybody's half penny at work after passage of Choose How You Move. These improvements make our transit system more convenient and reliable. WeGo is also testing out new real-time information system displays at 18 selected bus stops throughout Davidson County. The new digital signs provide real-time bus arrival and departure information at the busiest stops. In the last 2 weeks, we've had no reports of violent crime at any WeGo transit center, and so far this year, we have a 50% reduction in crime at transit locations. Thanks to Choose How You Move funding, our budget supports 29 new officers to build our first transit security division at Metro Nashville Police Department, to build on the great work Captain Brian Williams and the department are doing to ensure that riders are safe. This week, we welcomed 16 more officers to the Metro Nashville Police Department. I've sworn in 220 new officers from 14 sessions since taking office, and every time it is a special moment, and I appreciate the work that they do. MNPD provides more than 892 hours of training for a basic recruit, which is nearly twice the number of hours required by the state. And our increase in force is paying off, with all but 2 crime categories being down this year. Residential burglaries are down 28%, robbery is down 24%, homicides are down 15%, and violent crime overall is down 11%. Consistent effort is producing consistent results. So we've talked about improvements to services and safety. I do want to talk too about progress we've seen in schools. Our Metro School students and teachers are again proving exemplary. The 2025 spring TCAP results, state testing, a comprehensive measure to a test to measure learning progress, showed that more of our students than ever before are meeting or exceeding the expectations the state sets. Metro Schools had its best performance ever under the current standards in English language arts, math, and social studies, and its best score in science in 6 years. Our local gains were greater than the state average in those same subjects, and since testing resumed after the pandemic, student proficiency is up 13 points in English language arts, 13 points in science, 19 in math, and 18 in social studies. That brings us to another key focus of our budget, which is housing. Yesterday, we broke ground on Park Center's latest project, which will be for folks facing mental health and substance abuse issues. It's a wonderful way to provide stable, affordable housing and connect residents directly with supportive services. Park Center received funding from our Barnes Housing Trust Fund, and 26 new affordable homes are likely to welcome residents to Gallatin Pike next year. Our unified housing strategy qualifies us for the progress we must make on housing, and each incremental step forward is one not just for the city, but for the residents that will call it home. Also, finally, July is National Parks and Recreation Month, and a great time to visit any of our great metro parks. Build Together, Play Together is this year's theme. It reminds us of the contributions of the hundreds of parks, recreation professionals, including our dozens of part-time and seasonal workers and the many volunteers who keep our parks beautiful, welcoming, and safe for everyone. Our Metro Nashville Parks Department encompasses approximately 16,000 acres of parkland, greenways, and community centers. We're making concerted efforts to make them the best they can be for Nashvillians by catching up on deferred maintenance and making targeted investments through our budget for improvements like lighting and security. And over the next week, you can find all kinds of summer fun, creating your own mini bottle terrariums, family movie night, a back porch ice cream social, a family square dance, and a water balloon fight, all in our metro parks. And then just some more big news over the holiday weekend. The 2034 Special Olympics Games will be held right here in Nashville. We're finalizing an agreement with Special Olympics over the next few months. But Special Olympics Tennessee put together a great proposal showcasing our city. It's a big win for Nashville, and I know the athletes will feel at home here during the games. We can't wait to welcome them. And with that, happy to take questions.
Mayor, the Beacon Center recently came out with a report, Nashville spending $219,000 on lobbyists. With the staff that you have, why not use your own people to build those relationships and represent Nashville's interests? Why go spend that money?
This is not something new to the city of Nashville. We have always needed people, for instance, in Washington, D.C. It's not just engagement with the Metro Council or the General Assembly. It is also engagement with Congress, the White House, and so it's very important to be able to have relationships that exist outside of the city.
My follow-up to that is only Knoxville and Chattanooga spend more in the entire state. A lot of bigger cities spend zero. It's in a climate where we're raising property taxes, and shouldn't we look at every dollar?
Dennis, you just identified two smaller cities that spend more. I would say we're offering Nashvillians good value for their dollar as we seek to protect programs like right here at Metro Public Health.
But they're not 5 minutes away. You're 5 minutes long.
Yeah, we do have a lobbying team that works hard because I think you've seen a lot of state interest in what happens in the capital city, and we need more than one person on Capitol Hill. Thanks.
Mr. Mayor, this is a follow-up to the request for information about the food deserts. Have you already heard from any specific areas, residents living there, have impacted other in those communities?
Yeah, I think part of this timing, I know from parts of the city that I represented for the past 8 years where actually pressure has increased. The Napier and Sudicum communities right near Chestnut Hill as well have watched a loss of a CB grocery store, a local market. That community is facing increased pressure. There are great groups like Napier Kitchen Table trying to provide some occasional access, but that corridor has actually seen reductions in availability of even minimal grocery availability. Similarly, just around the corner from where I live, the Kroger on Monroe Street is now closed for months for renovation, and so area residents, including at Cheatham Place and the historic Buena Vista neighborhood and a lot of that North Nashville area, are facing increased pressure. Dating back years, the Edge Hill community, in fact, came to the Nashville MTA board when I was still serving as a board member and talked about how the closest real grocery they had was the Kroger out on 8th Avenue South. And increasing transit access even back then was a partial solution. So we're trying to do a few things at once. Improve transit reliability and access to scenarios where people may be able to get groceries more easily that way as part of that commute, but also look at community-based options that would put healthy produce, protein, all the kinds of things, including things that are locally grown and support ideally local and regional farmers within arm's reach. Thanks. Yep.
Follow-up question to that as well, if you don't mind. As far as an update possibly on the library after the fire.
Yeah, we know it is closed at least for the next few weeks. I'm also aware that they have advised scheduling that they had suspended, I think, internal scheduling as far out as October as they're just assessing equipment, materials, health and safety within all of the spaces in the library. I don't have an update right now on either access to the library when we expect the doors to open to the building. I think the garage is going to be an even more complicated situation. Yeah, thanks. Yeah.
Yeah, we can know, did you have a program for newborns and moms? And also we see a little bit more increase for the food reserve. But what about our kids between 6 years old until, the 12th grade?
Yeah, I think we've looked a lot at expanding opportunities for especially early childhood, both literacy and childcare access. We have seen, just as I was taking office, the announcement of the Nashville Early Education Coalition. They're doing some really important work that we are partnered with, again, alongside programs like My Brother's Keeper, which our office has supported. And then we were very excited. One of the things we announced in the state of Metro was Begin Bright, which is going to start to put Imagination Library stocked little libraries and childcare centers across the city. That starts this fall. So we've got some really good coordination happening for families at the pre-K level, and then I think what you just heard about Metro Schools for people on campus. Metro Schools continues to deliver results. They've got one of the things we include in this budget was long-term support for their scholars portfolio, which I know a lot of families across the city are taking advantage of right now this summer. Yep, thank you. Yeah.
April Calvin suggested that if a property owner wants a homeless camp cleared, they should pay for it or help pay for it. Is that going to be a policy in Nashville?
I don't know. I've heard just a little bit about the most recent Homelessness Planning Council meeting. I don't think that's a documented policy, but I do think at every turn we're looking to ensure that we offer secure and stable housing and reliable services to as many people in encampments as possible. I know in some cases we have had property owners participate in that support, and I think that's totally reasonable. I don't know that that's a policy yet, though.
Is that something people need to do if these things pop up as other camps close down? Is it on the people if there's tents near them?
Well, if you talk to either OHS or even police, especially with changes in state law, I think a lot of times for a variety of reasons, property owners may get trespass waivers. They may be tracking these kinds of things. I mean, I wouldn't say a property owner has an obligation to unilaterally prevent encampments, but that's also why we're trying to do this in a collaborated network. I think, if we look at our continuum of care approach, if we look at opportunities like Strobel House, Hospitality Hub entering the market, we're trying to provide not just long-term housing, but also some rapid rehousing options. And I think we've seen a lot of success of people not returning to homelessness even just over the past year. So we've still got more work to do. We've got to do that with property owners. We've got to do it on public land as well. So there's more work ahead. Okay.
Hey, Mayor. This is actually a Tom's question. So we know, I'm sorry, strategy.
I mean, I may need to bring Alex up.
Yeah, right. Well, you switched over to using Blue Sky to make official city notices instead of using X. And this week, the council committee, executive committee also are talking about switching over to Blue Sky. So is there a reason why you're deliberately switching over, kind of like switching the strategy to, in kind of abandoning this wider reaching social media audience?
No, I'd say one, we don't have a written policy about it. You'll still find multiple Metro departments on X, some not on Blue Sky. There's not some approach. I think we've generally allowed departments to find where they get the best reach overall. For me on a personal level, I tend to use X a lot less often now. But I think it changes. We've measured where engagement is. We've seen, we experimented with Threads and a couple other places. We've generally not used TikTok either. So our comms team is constantly evaluating things. We know PIOs and the comms teams across Metro are evaluating every day. Yeah.
Recently, the family of Jocelyn and Anna Correa have been signed a lawsuit. Has the city reviewed the lawsuit and how does it impact the city?
I think Metro Department of Law is aware of the lawsuit. I will say Again, going back to the moments of that tragedy, I got to visit with the family. I know how indescribably devastating a loss this is for them. I think they are probably pursuing an appropriate way to offset some of that devastation, and I know that they've probably endured costs beyond just the emotional cost as they do it. I haven't looked at the details of it. I am aware that the young man who was the shooter seemed to have a complicated history, and I'm sure the details of that will come up as a result of the lawsuit, but that's as far as I've looked so far.
Let's do two more.
Stephen?
You mentioned coordinated entry. How disruptive is closure like the 4th of July or Canada to that process?
It's hard to say from a quantification standpoint. I think we, as a former HPC member myself, I think we tried to strengthen both coordinated entry and the tough parts about our first loss of Metro employees directly related to cuts that seem to have originated from a DOGE, Department of Government Efficiency approach at the federal level that resulted in job losses right here at MPHD. Similarly, you've probably been aware that we've engaged in a handful of lawsuits to try to protect funding that we believe was, tried to be rescinded without, frankly, what we considered unlawful overreach that was congressionally approved. In the budget that just passed, there's quantifiable impact to Nashville based on SNAP benefits being cut and long-term loss of Medicaid benefits, and so we're absolutely trying to quantify that. We think from federal funding flows into Metro, we're still looking at how can we best comply with new terms of programs, look for maximum alignment with things that we're already doing that were already aligned with previous federal programs, and so we're going to try to continue finding access to as much federal funding as we can, but we know that the bill that just passed, we know that the DOGE process and upcoming potential for further rescissions are going to put pressure on us as a local government and other governments across the country.
All right, thanks everybody.
Thanks, everybody.
I do want to note that Bailey Laird and her family are here. She's been a participant in Nashville Strong Babies. Would love to talk